today to talk about vaccine, which I know is top of mind for all of us here in King County and our community. Just for our media partners, I want to let you know that you are welcome to listen either in English and Spanish. And for our Spanish media partners, you can look down at the bottom of your screen towards interpretation and select Spanish. Se puede presionar el globo en la parte inferior de la pantalla para escuchar en español y ahí se escucha todo. Bueno, muchas gracias por estar con nosotros. Thank you all for being here today. And we are now live streaming on Facebook. Thank you to the community for joining us today. And you can also follow this in Spanish on Condado del King. Thank you all for being here as we talk about vaccine. First, we are going to open with Executive Constantine, who has some remarks, and then from our partners and council members, as well as Director Patty Hayes from Public Health Seattle and King County. With that, I'll turn it over to you, Executive Constantine.
Well, thank you, Sharon, and thanks to everyone for joining us this morning. It's been a strange week. The people of our nation, the people of our region have every right to feel distressed and distraught by what we've witnessed in recent days. The riots and the mayhem on Wednesday capped what we've all lived through for the last 4 years. We look to January 20th with hope as a new beginning, a national rebirth. The vaccination rollout overseen by this administration is sadly consistent with the general incompetence and lack of discipline with which it has handled all of the pandemic. It's up to us to make this work, just as it has been up to us to set up high volume testing centers across the region, isolation and quarantine facilities, safe places for those who have no place to call their own, and so much more. Today, I'm announcing that King County will step up again and create high volume community vaccination sites and mobile teams to make sure we hit the ground running as this next phase of vaccines begins. These local efforts will complement the state's vaccination plan. Public health estimates that 70% of all adults will need to be vaccinated for us to get this pandemic under control. That's more in King County, that's more than 1.25 million people, and it would take 6 months under a very aggressive plan that administers 16,000 vaccines each day to reach that goal. Inadequate supply chains and the challenges of mobilizing an already stretched medical workforce already threaten to stretch that timeline even further. To make sure we don't miss a step, I'm working with our council leaders to direct $7 million to create community vaccination centers and mobile teams to reach people as quickly as possible. The sites will reach high-risk workers in healthcare settings and residents and staff of long-term care facilities. And once we're ready to move into the State Department of Health's 1B phase, the sites will be able to serve older adults and essential workers 50 years and older in congregate settings like teachers and grocery store workers and transit operators. And it will reach those who are 50 and over who are living in multi-generational households. We will create community vaccination sites similar to our high volume testing sites. And many of you have seen those in action. And we're looking at locating the first facilities in South King County, where we continue to see high rates of COVID and also distressing health disparities. We're paying for these facilities out of the King County budget. We are not waiting for all the usual negotiations and contracts, but we expect to be reimbursed by the state and federal governments if we are to continue a robust public health response. Finally, we pledge to work with our partners at the City of Seattle and in business and labor and the healthcare sector. I know our hospitals are eager for supply chains to firm up because they are ready to get more doses into people's arms right now, today. Many employers and labor unions will offer their own vaccinations to their own people, and we want to make sure this happens and happens seamlessly and equitably. What's more, we need our business and philanthropic community to help us meet this tremendous challenge in every community so we can return to our old routines and patronize beloved establishments and rebuild this community and create more economic opportunity for people moving out of this disastrous pandemic. Since the first days of this terrible disease, we have been alone really with our partners at the state and local levels. We've been isolated because our federal government has not been there in the role that it has historically played. We've come to expect almost nothing from the national government, but that will soon change. Our spirit of cooperation and our dedication to the health and safety of each and every one of our residents will not diminish. Rather, as we approach these last big hurdles, we are going to do everything possible to make sure we all get through this to the other side and get through together. It is my pleasure to introduce to you first to speak King County Council Member Rod Dembowski.
Well, thank you very much, Executive Constantine. It's a pleasure to join you and my colleagues here today. I want to start by thanking you and acknowledging your tremendous leadership during the pandemic in 2020 and now sadly heading into 2021. Your steady hand at the tiller, your years of preparation to make sure that King County was a capable government with the resources to respond to this kind of emergency doesn't always get the recognition at the time when attention isn't being paid, but it is now. And the results, I think it's fair to say, with our public health department in comparison to the federal government, speak volumes, and that's in large part due to your leadership, and I want to acknowledge that here. We lost, I think many of you may have seen the great Dodger baseball coach Tommy Lasorda yesterday. Lasorda said there's three kinds of baseball players: those who make it happen, those that watch it happen, and those that wonder what happened. Executive Constantine, you mentioned the federal government. They're wondering what happened, but here in King County, we're going to make it happen. And that means implementing this plan and improving upon it to make sure that King County government are equity makers and barrier breakers with respect to distributing these vaccines, getting shots in arms. We have built into our DNA all of the right ingredients, I believe. That is 130 years of experience in our public health department in deploying vaccines here in King County. And that is DNA of equity, an equity lens in all of our work. And you touched on that, Executive Constantine, with the focus on those most impacted in the community, communities of color, immigrants and refugees, largely concentrated in South King County. When I talk about barrier breaking, I want our plan to be focused on that. And that means shedding and breaking down barriers that our complex healthcare system has imposed. I think of my dad, who has a regular healthcare provider at the UW Medicine, but he still has to get from Renton to Harborview Hospital's campus or over to the Montlake campus. At 92 years old, that takes some doing. You got to schedule. You got to get transportation arranged, take the bus. I want us to bring these, with our health department and our partners, vaccination pop-up clinics into the community, at our senior centers, close by, not require appointments, but have a schedule out there where folks know they can go and get it done. Break down those barriers so we can speed up the deployment. You talked a little bit, Executive Constantine, about the rate. I think the vaccines were first available, first capacity in December, about the 17th. And our numbers, the last I've seen, are about 2,000 a day. With our goal of 1.25 million vaccines, that would take, at that rate, over 600 days to get it done. And obviously, we need to speed that up. That's not our goal. We want to do it faster, and I believe we're equipped to do it. I do think you mentioned our partners in the private sector, that we should tap some of the resources we have here in King County in terms of our nation or worldwide leading logistics folks. We have a healthcare expertise and a medical expertise, but I think let's bring on some logistics folks to help make sure we've got this right, whether it be Amazon or Expeditors International. We have talent here in the county that's ready to serve, and I think that they could add some value. So I look forward to supporting our department with this budget request getting the plan strengthened and implemented. And I know that we have the right people and the right values and the right capabilities to implement this in a nation-leading way. And I'm excited to support it. Thank you for having me join you today.
Thank you very much, Councilmember Dembowski. And now we'd like to hear a few words from Councilmember Cole-Wells.
Thank you very much, Executive Constantine, for inviting me to join you today. I echo much of what my colleague, Councilmember Dembowski, said, as well as your own remarks, and appreciate your continued leadership in crafting King County's pandemic response with your very bold action. As the Council's budget chair, I know that the economic challenges we will continue to face in the coming years and in budgets will be significant. Many of our revenue streams have been disrupted, and the economic needs of King County residents are greater than ever. But I am confident that now the federal government will reimburse us with COVID relief funds. But I will be working actively with you, Executive Constantine, and Public Health, and our congressional delegation to secure reimbursement. Frankly, we are making this investment because the current federal administration, as you mentioned, has failed to fulfill its responsibility to support local jurisdictions through the pandemic. With that in mind, we have had to take essential and significant measures in order to provide the services needed by our residents. The need to expand our public health infrastructure to prepare for administering vaccines is urgent and vital. And as we have heard before, we have to make sure that vaccines are accessible to all King County residents and healthcare workers and other essential workers, regardless of their connection to traditional healthcare systems. Our hope is that the locations of these sites will make vaccinations easy to access and quick to complete for folks who have constrained time and other health disparities. I really appreciate that you are looking into mobile vans as well. Throughout the pandemic, equity, accessibility, and expediency have continued to be our priorities. I am heartened by this investment because I know that it aligns with these priorities. I appreciate the daily and largely unrecognized choices made by our constituents that have helped us keep our numbers as relatively low as possible, and will continue doing everything in my power to ensure that these choices are as accessible as possible. Thank you, Executive Constantine.
Thank you very much, Councilmember Cole-Wells. And now we'll hear a few words from Council Chair Balducci.
Thank you very much. And thank you, Executive Constantine, for this work and this announcement today. It's been a really hard time in King County for a lot of people, but we have had a few great things going for us since the beginning of this pandemic. And one of them is that we have one of the best public health departments in the world. Our people have been on the front lines since the beginning when the first cases of COVID-19 appeared in Kirkland, Washington, in my district. And we also have going for us that our council, we are nonpartisan nominally, but yes, some of us are Republicans and some of us are Democrats, has stood firm and united behind the county's pandemic response. And we continue to do so. We have supported the pandemic response with resources, with time, with energy, with distribution of masks and other things that the council is able to do to support our executive branch and our health department. While we're hopeful today for federal funding and support, here at local government, we can't wait. We can't print money. We have to have a balanced budget, and we can do what we can do within our budget. I am very pleased to give support to the idea of making this stretch investment because it's important and it's timely. I, like my colleague, Councilmember Cole-Wells, our budget chair, is hopeful that support will come through from other levels of government, especially the federal government. But if it doesn't, I commit here to work to tap into our already partially tapped rainy day fund to support this work, because our residents need to get back to work. Our families need their kids to get back to school, and the vaccine is the key to those things, getting enough vaccines in enough arms in enough places. So I commend and support the county executive, our public health leadership and staff, and my colleagues, and we are here to commit to step up, to do whatever we can to support this effort to make sure that we get this vaccine spread throughout King County so we can start to turn the corner on COVID-19. Thank you.
Thank you so much, Council Chair Balducci. And now we're going to hear from Director of Public Health, Patty Hayes. Patty, I'll turn it over to you.
Thank you so much. And thank you to all. Thank you, Executive Constantine, for your tremendous efforts and support to ensure our region has all the tools possible to address the pandemic. And to the council members who have been with us every step of the way, my gratitude overflows. The unity we've had to support our communities and striving for the best possible health outcomes for our residents during this pandemic is just exemplary for the entire nation. And I am very proud to stand with you and be here in King County. As you're probably aware, earlier this week, the Washington State Department of Health announced guidance for the next groups of who will be eligible for vaccine. Those groups broadly include older adults, as well as older high-risk critical workers. Given the very large number of healthcare workers in King County, we anticipate that it will take several more weeks before there'll be enough vaccine supply allocated and the capacity within the healthcare system just to get through that phase 1A that was launched in December. But at the same time, as you've heard, we are not waiting. We're planning for the next phase. King County, our experience with COVID-19 testing indicates that to reach people at scale and serve the most vulnerable, both high volume vaccination sites and mobile strategies are essential. And from our experience with the influenza vaccine, we also know that employer-based vaccine programs and community-based clinics and pop-up sites can increase uptake. That is why it will be critical for partners across our region to come together to implement the strategies to increase vaccine access. There are 6 ways that I'll be discussing this with as many of our partners as possible and with the support that you're hearing here today through the healthcare system and our partners who have already stepped up, through the pharmacies who have an arrangement with the federal government in a go-first strategy with long-term care that has frankly gone very slow. And we are looking for ways to work with those pharmacies to shift that, to expedite that more quickly for our most vulnerable older and elderly adults. But there's also pharmacy access that will help the whole community. That will be critical as we open up to the newer phases. Employer-based vaccination clinics are going to be key. And as I said, high volume community vaccination sites and mobile vaccine teams, as well as what we can do to plan in partnership with community centers, faith-based organizations, other trusted community-based organizations to create community-based vaccine sites. Public health will be focusing first and foremost on our role to address gaps in vaccine access, particularly in areas of the county that have been hardest hit by the virus, for those who are most vulnerable and do not have access to vaccine through the healthcare system, and those who are isolated, including older adults. Specifically, we aim to stand up, as you've heard, 2 high-volume sites, likely as a phased approach. So as soon as sufficient supply of vaccines available, we're ready to serve, and starting in South King County, where we know the needs are the greatest. We're hoping this will start as soon as February 1st, and we plan to launch mobile vaccine teams as soon as possible to connect to the very at-risk populations, such as those who are in adult family homes and really shouldn't be traveling to clinics or where it's too challenging. And then others, like those experiencing homelessness and vulnerable older adults in other settings. Those will all be attached to the phases that have been described. And again, we're emphasizing first that phase 1A to complete. We are hoping for funding from the federal state level, and the $7 million is an incredible down payment to help us take that first step towards the much larger scale effort that will be necessary to connect that 70% of all who can qualify for these vaccines in King County to receive them. The rollout over the next several months will be dependent on many things. I anticipate we may continue to experience an adequate supply chain for both the vaccine and other needed materials, as well as the challenge for mobilizing an already stretched healthcare workforce to serve as vaccinators. We need the doses, and it will also be important to have simple, user-friendly systems such as mobile website and easily accessed through smartphone technology so that people can easily see if they're eligible, get connected to the vaccine. DOH has an initial tool under development for that, and I'm speaking with DOH regularly about what we need to make it successful here in King County. While our public health staff will be deeply involved on vaccine planning over the upcoming weeks and months, we must keep front and center the impact of the virus that it continues to have on our community. The number of cases continue to be at very concerning levels, an average of 417 cases per day. That's why our public health COVID-19 efforts, along with our focus on access to vaccine, have to continue together. We will be diligent, continuing to monitor the outbreak, provide case investigation, contact tracing, access to the testing, and the work that I know the community counts on to ensure that all our communities have access to the information and services they need. For now, until we have large numbers of the public vaccinated, this will remain a tough winter for us. That's why it's so important to continue to avoid indoor gatherings, keep using masks, keep physically distancing. It makes a difference. And we can see that it makes a difference in our cases when we're able to see those case numbers go down and when we bend that curve. And importantly, let's continue to take care of one another. We're so good at that here in King County. Let's be that shining star for the whole country. Let's continue checking on our neighbors or someone who may be isolated. Let's not forget our young people. While clearly now more accustomed to life with COVID-19, they continue to need extra support and a listening ear from trusted adults. Let's remember what our essential workers have been doing months on end to keep our society going at added risk to themselves and their families. I just want to say thank you to our community for your continued strength, resilience, and commitment to protecting the health of all of us. I know how hard this has been to get through, but we see the horizon and that light at the end of the tunnel. Thank you so much.
Thank you very much, Director Hayes, for your comments. And I'd like to turn it back over to Executive Constantine just for a few closing remarks before we take questions from the media. I know we all are anxious for the day when we can all do this in person and don't have to deal with some of the challenges of online video and Zoom. And I know that it took a little bit for Executive Constantine to get spotlighted visually. So for our TV partners particularly, I'd like to turn it back over to Executive Constantine to say a few more things so that we can make sure we have that. And then I'll go ahead and take questions from the media. So any other final thoughts, Executive Constantine?
Okay, well, just to reiterate then, we've had a rough week and a rough 4 years, and we're all, counting the moments until we have a new administration. And President-elect Biden has promised to push out more of the vaccine more quickly. And we here in the county are going to make sure that we are ready to get that vaccine into people's arms immediately. And that is why we have determined that we will push forward with mass vaccination clinics as well as mobile clinics and other strategies that will make sure that whatever vaccine we receive can immediately be distributed to the people who are eligible to receive it. Only by doing that are we going to be able to get a handle on this horrible pandemic. Only by doing that are we going to be able to protect the people in our community who are the most vulnerable. And we really are looking forward to having a partner in the federal government as we stand up this additional vaccination capacity here locally, a partner that can help increase the supply of the vaccine. If there's going to be a bottleneck in this system, it's not going to be here locally, but we want to work with them to make sure that there are no more bottlenecks, that there is only a unified system with partnership from the federal, state, and local level with public and private partners to make sure that we are finally providing the help the people need in this dire crisis. I know that Patty Hayes, our public health director, has more technical information and the ability to answer questions about the way in which some of these vaccination modalities could work and the particular audience or the particular population they are aimed at. But we'd be glad, any of us, myself, the council members, to take any questions that reporters might have.
Thank you very much. I really appreciate that, Executive Constantine. So we'll take some questions from the media. I'd ask that you use the raise your hand function in Zoom, and then I will unmute you and call on you to ask your questions. I know we have quite a few questions in the queue, so please say the name of your news outlet, and if you can limit it to one question to get us going, that would be great. And before we jump in there, we also have questions coming in also from our community, which are really important. So I'd like to just start one question off for you, Patty Hayes, that I know is on everybody's mind here, which is, how do I know when it's my turn? How can I find that out? I know there's so many messages going on, so much confusion nationally. So can you just help our community know, how do we know when it's our turn?
Yes, that's such an important question. And the State Department of Health is launching something for those that have a smartphone and that technology link that's called Phase Finder. Phase Finder will ask you a few questions, and it will show where you're at in line. In addition, we will be putting that information out through lots of different resources as we learn more from the state. Right now, Phase 1A, the folks that are in line for Phase 1A are those frontline healthcare workers, our EMS personnel, and then the long-term care facilities, so nursing homes, adult family homes, and the supportive living facilities. So we will be publishing that and amplifying as the state gets it out so that the media can have it, the local organizations can all have it. We'll be having this technology from the state. We'll also be supplying it to important places like senior centers and others as we're getting out with our community partners so that folks know. So it needs to be kind of an all hands on deck way of getting the information out.
Thank you. And our question from Carolyn Beck, you're unmuted.
Wonderful, thank you. Can you hear me?
Go. Yes, we can. Go ahead.
Okay, great, thanks. I appreciate it. So I wanted to ask, because on January 2nd, there was a new COVID outbreak in the King County Jail in the same unit as the 16-person outbreak in early December. From what I understand, between the early December outbreak in the prison and the January 2nd outbreak in the prison, nothing about the cleaning schedules or the precautions changed. So I was wondering what public health officials who work in the jail are going to do differently this time around to ensure against yet another outbreak.
Let me start, and then Patty, you can follow on. First of all, at the beginning of COVID, we immediately moved to create a safer environment in the jails. So we put in booking restrictions to reduce the population so we could spread people out, particularly those who are the most vulnerable, people in high-risk populations. And we have managed to avoid widespread outbreaks, unlike almost every other detention system in the country, throughout COVID. We had one outbreak in December. I think we had 20 or so people who became infected. Public health jumped on that, tested everyone. There was isolation, quarantine, and quickly wrestled that under control. We had a small flare-up in early January last week, where I think there were 4 or so people who were identified as having been infected. We've gotten that under control as well. This is obviously tremendously difficult, but the testing protocols, the cleaning protocols, the distancing protocols that we put in place at the start have proved tremendously effective. And you can see that if you just compare our record against almost anyone else in the country. Patty.
Yes, thank you so much. What I'll add is that we know that COVID is going to show up in these facilities. That's why we're testing each person that gets booked in, because we know that we're going to find people who have COVID. In addition, we know that there's just a ton of community spread of COVID. So it's not realistic to think that the staff is not going to at some point contract COVID. So we are aggressively managing this, and I think the success that Executive Constantine just outlined is a testament to the team that's working together, both my jail health services team as well as DAJD, to manage these. We have aggressive protocols. We believe they're good protocols, and we continue with each time we have an outbreak to debrief and look to see if we need to improve anything. We're all about that every single time, but we are continuing to just manage this and are realistic, just like with every other institution or business, to realize that it's a matter of managing it. You can't avoid COVID coming into these spaces.
Thank you. Simone Del Rosario, you're unmuted.
Thank you very much. My question's for Director Hayes or Executive Constantine. What's your message to people ages 65 to 69 who have been told throughout this pandemic that they're high risk, but are now largely left out of the planned phases so far until May to get those vaccines? And then also with President-elect Biden's plan to push out all available vaccines without holding back second doses, there's certainly concern about people being able to secure those doses. How are you going to guarantee that those second doses will be available for people in this county?
Well, I'll just begin by saying that I'm very concerned, of course, about everyone who wants and needs the vaccine, including those between 65 and 70. And this failure to be able to produce enough vaccine is just causing prioritization to have to happen. The state is doing the prioritization. We are receiving from State Department of Health the sort of listing of who gets the shots first. And here in the county on the ground, the job that we can, the role that we can fill is to make sure that when those people come up in the priority order and when the vaccine's available, that they are immediately and in a way that is fair and equitable able to get the shots so that we can protect the most people and the most vulnerable people as soon as possible. Patty, did you want to try to address those?
I think that you made excellent points, Executive. The only thing I will add is that as the folks between the ages that you mentioned, when they get into Phase Finder, if they're living in a setting where they're with other vulnerable adults, I talked to someone just yesterday who had their elderly parent living with them. You can, through Phase Finder, actually put in that other situations for yourself. Are you in a situation with an older adult? Are you a person that has chronic conditions, et cetera, to find out? And as Executive Constantine said, this was set based upon the estimations for the number of doses that we, in the state of Washington, the State Department of Health is expecting to get. There, again, as you said, there has been a guarantee, as good as a guarantee that can be possible, that allocations are set aside for the second dose, and that's indeed how we're being communicated with from the doses giving in December. We're having the State Department of Health is setting aside doses to send to us so that people get their second dose. So we will continue to work with the state to make sure that that doesn't get skipped, because it's a very important, it's essential.
Thank you, Patty. And we have Mario Zavaleta from Latino Northwest Communications, but Mario's having some difficulties with his audio. So I'll read his question and then interpret it very quickly for you. Mario is asking, el condado de King tiene una alta población de inmigrantes y refugiados. Muchos de ellos son trabajadores esenciales y no cuentan con seguro de salud. ¿Cuál será el costo de la vacuna para este grupo? O sea, les proporciona de manera gratuita. So Mario is asking, given the high number of immigrants and immigrants in our community, many of them are essential workers and don't have access to health insurance. What will be the cost of vaccine for this group, or will this be free for individuals? And Patty, I'm wondering.
Yeah, that is a great question. Thank you. The vaccine through our sites and through this system will be free. So someone who doesn't have insurance or is underinsured does not need to worry. It will be free. It's very important in our plan that we're actually getting this vaccine and prioritizing vaccines to communities we know are in areas where essential workers are, et cetera, as part of the 1B rollout. That will become clearer as we get the vaccine doses. So again, right now we're concentrating on the 1A, but essential workers who are those frontline workers, as Executive Constantine outlined earlier, we will have different ways for people to access vaccines, and it will be free.
Thank you.
Patty, this is Rod. Could I just add a little to that? I think it's important to assure our community and remind our community that in delivery of services at King County, we do not check your immigration status. We do not ask for proof of citizenship, residency, anything like that. We are a trusted place to come for healthcare. And I want to encourage the community to come forward without fear to get this medicine.
Thank you very much. Important message. Now we'll go to Megan Campbell from Puget Sound Business Journal. You're unmuted.
Good morning. My question is for Director Hayes. I was wondering if you could elaborate on the 6 ways in which employers can help create those vaccination clinics, and whether or not you're talking about large employers or if there's a place for small businesses to be involved in this process as well.
Thank you for that question. I'm excited to work with the business community on what will work for them. I think that there are a number of ways large and small businesses can work, as well as large businesses helping smaller businesses would be just, I think, a tremendous support in our community. So businesses can, of course, if they have the space, so this would be the moderate to large businesses right now, could hold their own to help vaccinate their own employees. So I expect we're going to have those kind of conversations with our large employers. There are already large employers that are thinking about that and starting to call us to say, if I'm vaccinating my entire large workforce, how can I actually serve the community and open that up? Is there a way to do that? That is a gift to the community. We're going to be very excited to talk about that with employers who have the capacity to do that and have the space to do that. Next, there are certain employers who have large spaces that could be assistance to us. And we will be looking to see, can we match partnerships between space and the logistics of bringing vaccinators into that space and setting up pop-up clinics that could work that way. So that's something else. And of course, we would always appreciate any kind of monetary support from the business community. That's very difficult right now with the way the economic has been hit by COVID-19. But for those that want to help support and possibly adopt a site, adopt a pop-up site, or support a drive-through clinic, or support a certain population, we are looking forward to that, because businesses have such logistics expertise here. When you think about that, we need mobile teams that are going to go to people's houses to help them if they're homebound, or to go into communities where there are essential workers who need the clinic brought to them. Employers can be a great asset. So there's so many different ways these partnerships can go, and I'm just excited to see what ideas they have. I might not have even thought of it, and excited to have those conversations starting right now.
Thank you. Pablo Gaviria from Univision Seattle, you are unmuted, and feel free to ask your question in Spanish for your audience.
Thank you. So I can do it in English, but are the mobile units going to go from door to door, or how will it work? And also, if someone doesn't speak English, how will they make an appointment and have access to the vaccine?
That's great. Great question. So we are developing this mobile strategy, and for right now, with the need for particularly the adult family homes who are small congregate settings with up to 6 individuals being cared for, and a staff that cares for those folks on an ongoing 24-hour basis. The mobile team would literally go to that adult family home and set up the vaccination for that adult family home. So that's one model. A second model is we know there are homebound elderly that are going to be qualifying in that first 1B1 sub 1 category of 70 and older. Want to make sure that we are able to get the access to both their caregiver and themselves, obviously, if they're homebound. We will rely on everything from the senior centers to the developmental disability community to the state agencies that are providing services to those to help us identify those folks. Also, this technology that I mentioned, Phase Finder, would be another access point for them. So we're going to try and break down, as Councilmember Dembowski said, we're going to be barrier breaking here to find different ways to get that done. So my vision of the mobile teams will grow as our partners come up with their commitments, and also as we talk and as we get into these phases, begin to understand where those needs are, and we will sculpt it to the need.
Thank you, and thank you for that question, Pablo. Let's go to Evan Bush from Seattle Times. You're unmuted. Let's wait just for a moment to see if Evan can get
thanks. Appreciate it.
Yeah, no
I'm also curious about the mobile teams. When we're talking about mobile teams, is this a van, an RV? Would this be contractors or employees of Public Health Seattle and King County? And then how many doses could be administered in a day by these teams?
So yes, and it depends upon where they go. So yes, we want to use contractors. We're already doing that in our testing. As you probably know, with the testing that we're doing in shelters and in other partnerships with the Healthcare for the Homeless Network, those teams go out and we send a team, and then testing is done. So we're using those learnings to set up these. So it could be a van, it could be a regular, looks like a mobile medical van. Actually, we could use those. We think it's best to have at least 2 vaccinators at a time. So if they go out to an adult family home, they're going to know that there's going to be 6 residents there, probably 5 or 6. And then looking at to make sure the workers have also, because they're frontline workers, those people would be 1A, that they're vaccinated. So in that case, you can see that we would be able to do possibly a number of adult family homes in one day. That's very different than if we send a mobile team out and we set up a pop-up vaccination at another site where people are coming and could do, depending upon how many people are there. I know that the vaccination limited ones we've been working over the holidays for the EMS personnel, et cetera. We've been able, in some of these cases, to do 100 plus vaccines at a time in a day per vaccinator. So it just depends upon what we need to do. The volume will depend upon how much the mobile team needs to move around, where we're sending them. If they're going house to house, you can well imagine that, like with a nurse doing home visiting, there's a limited number of people you can see in one day. So we'll just do the best we can to get that out and meet the need that's based upon the community.
Thank you. Nick Popham, go ahead.
Hi there, can you hear me?
Yes.
Awesome, fantastic. Thanks so much. So this is either for Director Hayes or Executive Constantine. I was wondering your thoughts on the new phased approach that the governor announced earlier this week, and thoughts on, say, if King County gets fewer cases than Pierce and Snohomish County, but they're still in a group. Obviously, they can't move forward to, say, a phase 2 or things like that. So I was wondering your thoughts on this new phased approach by grouping counties like King, Pierce, and Snohomish together.
Well, I mean, I will give my view. I think that King, Pierce, and Snohomish, first off, are, one metropolitan region. So although we have these arbitrary government boundaries, people live their lives across the entirety of the region. And it is a reasonable approach to try to treat the region that way as a whole. The phases are frustrating, not because they're necessarily wrong, but because they just reflect this continuing inadequate supply of vaccine coming to us from the manufacturers and the federal government. And there are a lot of folks who can make a very strong argument that they should be in a higher up, a sooner phase because of their job or because of their health conditions or because of their age. And I am very concerned that we keep pushing the national government and pushing the pharmaceutical industry to be able to provide more of what we need here locally. Patty, if you have any more details on the phasing, I'd be really interested in hearing it.
Yeah, that's so well said. Thank you so much. What I would add is we're really talking about two phase issues here. So the phase for the counties to be put in these buckets, and then the opening of businesses in different phases. As Executive Constantine said, we're one region, and one of the things we've realized is just in watching the healthcare industry, as hospitals have been vaccinating their own employees, we are finding that because of where those employees live, it's showing up in the data in Pierce and Snohomish County. So it's a very real sign that we are one region. Now, I know that some of the smaller cities in all 3 of those counties are going to be upset if the three counties as a region are kind of locked in a phase and not able to open businesses. That's going to be frustrating. That was frustrating even when it was just the county. There was subdivisions that were feeling like they were doing better and wanted to go forward. But we need this unified approach. We know that our employees move between the counties for their employment and where they live, And so I'm committed to working with my public health colleagues in Pearson Snohomish. Then there's the phases about the vaccine, as the executive has very articulately outlined the stress of that. And that is indeed all about the allocation and the ability for the pharmaceutical industry to produce, and then the government to get the priorities out here and making sure they're doing it in a way that we can switch it. So if somebody can't use it, we can move it. And that's our request.
Thank you. Next, we'll go to Eilish O'Neill. You are unmuted.
Hi, thank you. I think my question is probably for Dow Constantine or Patty Hayes. I have some questions about the permanent mass vaccination sites that you plan on opening. You mentioned that you opened 2 sites in South County around February 1st. How many sites total do you envision your funding covering? And then I have some questions about those sites as well.
Yeah, your feed was breaking up a bit, but I think you were asking how many mass vaccination sites we would envision our funding covering. I believe right now we can afford, leaving aside whatever we're able to have our partners like Seattle do, we could do 2 sites plus the mobile units. And there are several other modalities that we're working on to kind of fill gaps. You know, this cascades down from people who have very strong connections to the healthcare industry, people who work at hospitals, people who have primary care physicians associated with hospitals, to people who have no medical insurance or physician at all and may be disconnected from the systems that would normally provide vaccinations. And so we are trying to construct a system that has modes that address each of these populations so that we can get the vaccine not to those most connected, but to those who need it most. Patty, do you want to fill in anything else? So the answer is 2, Patty.
That's exactly right. Nothing, couldn't add anything.
Great. And I know, at least you probably have more details to ask. Feel free to email PHPIO and we'll get those more details to you. I know we have still some more folks who are really interested in asking their questions. So let's go to Natalie Graham. You are unmuted.
Hi, this is Natalie Graham with The Stranger. My question is for either Patty Hayes or Rod Dembowski. Could you elaborate a little bit more on the other logistics help you're seeking from local businesses? And could you specify which businesses have approached you about helping and in what capacity?
So I'm happy to start. I think that we are a county rich with wonderful businesses that have expertise in different areas. And I'm just hoping to have those conversations and learn on and build off of what they see as possibilities to help our support. Because the more we have participation, the farther we can extend this effort. Because as they use their own logistics and their own facilities to help us, that allows us to save our precious resources to plug in other things and extend the effort. So I'll turn it over to Councilmember Dembowski.
I would agree with that. And I would just note that while the health department has 130 years of experience vaccinating King County residents, including myself as a child, I'm proud to say, that our vaccine infrastructure has increasingly relied on partners in the clinic community, partners out in the medical community, and our staff at the county health department is quite limited. I learned this when we were working on the HPV vaccination initiative to expand there. We really have just a couple, 3 staffers, kind of, as I recall, Patty. And so while we have the expertise and it's in our DNA, the capacity needed to deploy this vaccine to 1.25 million people in a priority order is a Herculean undertaking. And so I'm just suggesting that added assistance from folks who do this day in and day out is welcome.
Thank you very much. And we need to wrap up given everybody's multiple things going on, but I know we didn't get through all of the media questions. please feel free to email us and we will get your answers taken care of and connect you with folks to make sure we get your answers for you all and for the community. I just wanted to share, we were getting lots of comments also on Facebook talking about volunteers and others who are willing to step up, volunteer nurses, and we've been so grateful in our community, even with the initial vaccination efforts, to have those volunteers like the Public Health Reserve Corps who made this possible in the absence of federal funding and other support. So we could not do that without you, and we continue to partner with volunteers in our community. So with that, I just wanted to say a quick thank you to Claudia Azar, who's been doing simultaneous interpretation for our Spanish-speaking community. Thank you so much for your talents in doing that. And you can follow us at publichealthinsider.com. We'll continue to provide blog posts and updates on what is going on in this very rapidly changing fluid situation as vaccine is so critical. With that, I just want to quickly turn it back over to Patty and Dow for any final thoughts before we close.
Well, I will, Patty, if you don't mind, lead off just by reminding people that as we sit here talking about vaccines, the pandemic continues to rage, and we're even more concerned because of this new variant of it, the mutated version of it that seems to be more transmissible. So reminding everyone to not let down your guard, to redouble your vigilance, to make sure that we all stay healthy until that day that we can get those shots and achieve not only individual but community-wide immunity to this horrible disease. I think that we have here in King County proved that collectively we can make a real difference in a situation like this. And the fact that even this week we're seeing a leveling off and even decline in the number of people we're having to accommodate in our isolation and quarantine facilities, for example, shows that people are taking personal responsibility, and that personal responsibility results in a safer community. Patty.
Just a thank you. And the light is at the end of the tunnel. Keep supporting each other. Thank you so much.
Thank you very much. Thank you to the community for joining us today, our media partners for covering such important issues.